Dane just revealed the most heartbreaking truth about his ALS battle, and it's going to make you see every celebrity differently forever. The Grey's Anatomy star missed the Emmys because he was in the hospital getting stitches in his head after falling in his kitchen, which is exactly the kind of devastating reality that ALS patients face every single day while the world pretends everything is fine. At 52 years old, Dane is now in a wheelchair, struggles to speak, and has lost function in his right arm, but he's still trying to work because the entertainment industry doesn't care if you're dying as long as you can still perform. His TikTok videos about his health decline are going viral with millions of views. But here's what's really twisted. People are watching his deterioration like it's entertainment while he's literally fighting for his life in real time. He says he's going to ride this till the wheels fall off, which is both inspiring and absolutely tragic because ALS is a death sentence disguised as a neurological condition. When celebrities have to perform while their bodies are shutting down, every appearance becomes a farewell tour that nobody wants to acknowledge.
A woman's viral TikTok about ignoring cancer signs is exposing how the medical system trains us to dismiss our own bodies until it's too late to save ourselves. Jessica Farrington's post about how her body whispered long before it ever screamed has millions of views because every woman recognizes the story of being told their symptoms are just stress, hormones, or being a busy mom. She ignored fatigue, night sweats, itchy skin, and swollen lymph nodes for months, convincing herself it was normal life, until she found a pea-sized lump in her armpit that turned into a cluster and led to her non-Hodgkin lymphoma diagnosis. The most terrifying part isn't that she missed the signs, it's that doctors are trained to dismiss women's symptoms as psychological or hormonal, creating a system where cancer has to scream before anyone will listen. Her viral warning is resonating because millions of women are currently ignoring similar symptoms right now, brushing off their body's desperate attempts to communicate that something is seriously wrong. When the healthcare system teaches us that our pain doesn't matter until it's life-threatening, every dismissed symptom becomes a potential death sentence wrapped in medical gaslighting.
TikTok just got exposed for spreading mental health misinformation to millions of vulnerable users, and the platform is refusing to do anything about it because controversy drives engagement. A new report reveals that half of TikTok's top mental health videos contain dangerous misinformation, with 52% of ADHD symptom videos being completely inaccurate, meaning people are self-diagnosing based on lies that could destroy their lives. Mental health influencers with zero medical training are giving advice to suicidal teenagers and people in crisis, turning psychological emergencies into content opportunities while TikTok profits from the chaos. The platform has become one of the most common ways people get mental health information, which means millions of users are receiving treatment advice from people who learn psychology from other TikTok videos in an endless cycle of misinformation. TikTok claims removing misleading mental health content would oppose free expression, but they're really just protecting their algorithm that promotes controversial content because it keeps people scrolling through their psychological breakdown. When social media platforms prioritize engagement over accuracy, every mental health crisis becomes a business opportunity disguised as community support.
The deadliest flu season in 15 years just happened, and nobody told you because the medical establishment doesn't want you to panic about their complete failure to protect public health. The 2024 to 2025 flu season had the highest hospitalization rate since 2010, with over 1 million hospitalizations and 130,000 deaths, including 281 children. But mainstream media barely covered this medical catastrophe. 127 people per 100,000 were hospitalized, which is nearly 3 times higher than normal, yet health officials are calling this just an unusually severe season, like mass death is a weather pattern. The pediatric death toll of 216 children is the highest in 15 years for a non-pandemic year, meaning kids are dying at record rates while parents are told everything is fine and to just get their flu shots. This isn't just a bad flu season. This is evidence that our immune systems are compromised from years of medical interventions and environmental toxins that have left us defenseless against diseases that used to be manageable. When record-breaking death rates get buried in medical journals instead of broadcast on every news channel, every unreported death becomes a cover-up disguised as public health policy.
TikTok wellness influencers are destroying women's reproductive health by spreading conspiracy theories about birth control, and young women are falling for it because they don't trust doctors anymore. The contraceptive pill is under attack from spiritual coaches and supplement sellers who claim it causes weight gain, depression, and infertility while disconnecting women from their feminine energy. Which sounds like pseudoscience but resonates because women's health concerns are constantly dismissed by medical professionals. 60% of wellness websites are spreading misinformation about birth control side effects, leading to a massive decline in pill use among young women who are getting their medical advice from influencers selling overpriced supplements. These TikTok gurus are convincing women that hormonal birth control is poison while promoting natural fertility tracking methods that have much higher failure rates, essentially trading reliable contraception for wellness theater that leads to unplanned pregnancies. The most twisted part is that these influencers are right about one thing. The medical system does dismiss women's concerns about birth control side effects, creating a vacuum that gets filled with dangerous misinformation disguised as female empowerment. When legitimate medical concerns get ignored by doctors, every wellness influencer becomes a trusted advisor, selling lies to women who just want their pain to be acknowledged.
A hospital in India just got exposed for the most heartless medical scam imaginable, and the viral video is making people question everything they thought they knew about healthcare greed. Max Hospital declared a 1-month-old baby dead at 4 p.m., but continued demanding payment from the grieving family until 6 p.m. for treatment on a child who was already gone, turning a family's worst nightmare into a billing opportunity. The family's viral video shows them confronting hospital staff who kept asking for money for 2 hours after the death was declared, probing that some medical facilities see patients as profit centers, even after they stop breathing. The baby's body was still warm while administrators were calculating treatment costs, which reveals how completely the healthcare system has abandoned any pretense of caring about human life over financial gain. This isn't just medical malpractice. This is evidence that hospitals have become death factories, where families are charged for watching their loved ones die, and the billing continues even after the heart stops beating. When medical facilities can demand payment for treating dead patients, every hospital visit becomes a potential scam disguised as healthcare, and every family becomes a target for grief profiteering.
A nursing home in Hawaii just went viral for reasons that nobody will explain, and the media blackout is making people suspect the worst about what really happens in elder care facilities. Maluhia Skilled Nursing Facility became internet famous overnight with a video that news reports say will make you understand why it's viral once you see it, but they refuse to show or describe what actually happened. The nursing home industry is clearly trying to suppress whatever made this facility notorious, which suggests the content exposes systematic abuse or neglect that threatens the entire long-term care business model. When a healthcare facility goes viral and the media won't explain why, it usually means the truth would destroy public trust in an industry that's already plagued by scandals involving patient abuse, medication theft, and insurance fraud. The fact that this story is spreading through social media while traditional news outlets stay silent proves that the nursing home lobby has enough power to control the narrative, even when their failures go viral. Whatever happened at Maluhia is so damaging to the industry that they'd rather let conspiracy theories spread than reveal the truth, which means the reality is probably worse than anything people are imagining.
UC San Francisco just got exposed for conducting illegal medical experiments on children as young as 9, and the transgender scandal is revealing how the medical establishment uses vulnerable kids as test subjects for profit. Judicial Watch obtained 2,491 pages of documents proving that UCSF doctors gave puberty blockers to children who couldn't possibly consent to permanent medical interventions that will affect them for the rest of their lives. The youngest participant in their blocker study was 9 years old, which means they were chemically castrating elementary school children while calling it gender-affirming care and collecting research data on the long-term effects. These aren't treatments. They're experiments on developing bodies and minds, using confused children as lab rats to advance medical careers and pharmaceutical profits, while parents are told this is the only way to prevent suicide. The medical establishment is systematically sterilizing children and calling it healthcare, creating a generation of medical victims who will spend their lives dealing with the consequences of decisions they were too young to understand. When hospitals can perform irreversible medical procedures on children for research purposes, every gender clinic becomes a human experimentation facility disguised as compassionate care. A hospital just got caught storing 61 dead bodies for months without telling families their loved ones had died, and the cover-up reveals how medical facilities treat patients like disposable inventory. The hospital chief admitted they assumed the remains did not have families, so they just kept the bodies in storage while relatives waited for updates on patients who were already decomposing in the basement. Families are discovering that their loved ones died months ago while hospital staff continued scheduling appointments, sending bills, and pretending everything was normal, turning grief into a grotesque administrative error. This isn't just negligence. This is evidence that hospitals see patients as numbers on spreadsheets rather than human beings. And when those numbers stop generating revenue, they get filed away and forgotten like expired products. The bodies were rotting in hospital storage while families held on to hope, planned visits, and worried about recovery, creating a psychological torture that's worse than the original loss because it was completely preventable. When medical facilities can lose track of human remains like misplaced paperwork, every hospital stay becomes a potential disappearance where families might never know what really happened to their loved ones.
Celebrities are dying while performing, and the entertainment industry's pressure to hide health problems is creating a crisis where stars literally work themselves to death for our entertainment. Dane is battling ALS in a wheelchair while trying to continue his acting career, joining a growing list of celebrities who are masking serious health conditions because showing weakness means career suicide in Hollywood. The industry has created a toxic culture where admitting illness is seen as unprofessional, forcing stars to perform through cancer, neurological diseases, and mental health crises while pretending everything is perfect for the cameras. Fans are finally realizing that their favorite celebrities have been suffering in silence for years, turning every performance into a potential farewell that nobody recognized because the entertainment machine demands perfection even from the dying. The most disturbing part is that audiences consume celebrity health struggles as entertainment content, watching stars deteriorate in real time while treating their medical crises like gossip rather than human tragedy. When the entertainment industry can force dying people to perform for profit, every celebrity appearance becomes a form of medical exploitation, disguised as show business. And every fan becomes complicit in a system that literally works people to death.